Hello and welcome to Health Options with me, Rabi Abdallah. Over the past 50 years, scientists and engineers have developed various techniques for looking inside the body to diagnose disease and trauma. Examples include X-ray, CT scans, MRI, ultrasound, and a host of others. Pulsed electromagnetic fields are yet another non-invasive breakthrough. One of such is Ondamed. Ondamed, which in Latin means wave medicine, is a German technology that is based on the principle of electromagnetic induction to a highly framed pulsed electromagnetic field that penetrates deep into a targeted region of the body. The Ondamed system complements existing treatments including pharmaceuticals, homeopathic remedies, and nutritional supplements, and can also be safely used with other therapeutic modalities. On this episode of Health Options, we shall get you acquainted with the Ondamed technology and its workings. The key challenges faced by all countries is slowing the rate of transmission of the coronavirus to mitigate the overwhelming of health services. In the absence of vaccines or other therapeutics, the only armaments available to us to do are simple evidence-based non-pharmaceutical interventions. These include hand hygiene, social distancing, and universal masking. What is the place of the disinfection tunnel in the fight against COVID-19 and how does it work? Curious about that? Stay tuned for our expose on one of such. You'll also get to meet my guest, Dr. Silvia Binder, a doctor of naturopathic and energy medicine expert who will take us through the workings of the Ondamed technology in healthcare. Thanks for joining us on the program. This is Health Options, the program that not only tracks government's policies on health, but helps you to make informed choices on your health. The Ondamed technology in healthcare is our focus on this segment, and I have with me in the studio to take us through what Ondamed is all about, our naturopathic and energy medicine expert, Dr. Silvia Binder, and she's going to talk to us about the German technology known as Ondamed. Dr. Silvia Binder, thank you for coming on Health Options.
Thank you so much, Rabi, for having me. It's such an honor and pleasure to be on NTA with you and educating the public about such important issues of health and medicine. Thank you.
It's a pleasure to have you join us. Let's start with, what we know and what we didn't know, but we're about to know about right now. For instance, I know a lot of people are aware of MRI, CT scan, ultrasound, X-ray, and the likes. Ondamed, for me, and I guess a lot of viewers, it's a technology that a lot of people are really not aware of. Start with that.
That's good.
What exactly are we talking about?
When we talk in medicine about energy medicine, there's a strange connotation that people think, oh, this might be esoteric. But actually, everything that we do in physiology, with physiology and diagnostics and treatment, it breaks down into an act of electromagnetic events. So if we look at, as you said, X-ray technology, MRI, CAT scan, EKG, EEG, it's all measuring the electrical output of, in case of EKG and EEG, of the heart and of the brain. We're not measuring the chemical transactions. We're measuring the electrical output. Nobody knew about them, and when they made sense, when they were introduced and used, well, then it was like a standard care treatment or diagnostic. So this is a standard diagnostic equipment now. And so I think also with Ondamed, has been around for 26 years. So it's not new, but in medicine it takes a long time until new approaches are being embraced by the medical institutions and those who live and breathe medicine on a daily basis.
Okay, for a technology that had been in use for the past 26 years or so, and what is it that makes it more relevant more than ever now? Is it, for instance, we have the global community is contending with the coronavirus outbreak. Is it something that is giving room to the promotion of the Ondamed technology? Does it have a place?
Very good question. Thank you, Rabi, for that. It certainly has a place, since vaccines have not been found or even tested. Even if they have been found, it takes typically 5 years for vaccines to be thoroughly tested for their safety and efficacy. So we have a technology right here that can offer us the stimulation electromagnetically, which is much faster than the route of chemistry. For give you an example, when you turn on the light, you switch the light switch and the light is already on. It doesn't have to travel to get there, because that's physics. You see, everything truly, when you look at the basis of life, we understand and interpret it as from a mathematical point of view, and the next point is physics. Down the road comes chemistry. So if I can, in 5 years from now, possibly I have a vaccination that may help improve immunity against certain viral bacteria infections. But how much easier and faster, with no side effects and being non-invasive, we can use electromagnetic fields to stimulate a reaction from the autonomic nervous system, meaning that we're balancing sympathetic, parasympathetic nervous systems, which is essential for our immunity, for our immune system to work much better, and secondary, to attract immune cells to where they are most needed. So with COVID-19, for example, look, we can use one device to use on COVID-19 patients, or to even prevent it, a much better idea, right? So we can use one device for millions of people to come in the future.
How exactly does it work? That's what the layman wants to know.
Even when we deal with an infection like COVID-19 or cancer, the body needs energy in order to help heal and restore the areas of problems, right? Yeah. It's not the whole body that's sick. There's certain areas, and let's call them, well, inflammation. Stress causes inflammation. Inflammation, when I have a pain in my shoulder, I have a pain in my knee, well, it might be that the issues are related to the shoulder and to the knee, but it might be that I'm not eating properly, therefore my microbiome, the fluid in my body, is too acidic, inviting microbes, virus, parasites, fungus to have a wonderful temple here, to live in here, causing us to have pain in the shoulder and the knee. So instead of focusing in on those areas that are painful, we need to look at the gut. We need to look at the fluids that are traveling to all the organs in the body, to the brain.
So it's a more holistic approach, and
yes.
What do you call it? An investigation into what is triggering.
That's right. So we're getting. So it's not just a treatment device that treats your cancers. And as a matter of fact, we don't even treat disease, because diseases, we only have labels, names for diseases to throw a drug against it. I'm sorry to say that, but I just want to be very, very plain and say how it is. So at the end of the day, it's not the cancer that's the problem. It is what leads to that cancer to be the cancer. You know, what is the story of why do I have cancer today? And it might be an emotional involvement, a spiritual involvement, and it might be the involvement of not overcoming certain stress situations, stress causing inflammation, and inflammation causing organs to not work as well, which ultimately leads to a diagnosis of cancer. So with the Ondamed, we're finding the origin of the problems of where there are dysfunctions in the body, such as inflammation, infectious processes, sometimes lingering. We think that an old soccer injury is no longer a problem because, we overcame it, we don't have symptoms today anymore. But when I scan you with the hand applicator, introducing those focused pulsed fields that are like whispers to the body, never invasive. So even with patients that have pacemakers, implants, it can be used. So we're isolating an area, and I say to the patient, well, you have an issue on your right knee. And the patient will think and say, what does that have to do with my cancer? Well, it may have everything to do with it, because that injury never healed properly. Leaking toxins, waste products, stored up stuff that runs around in our blood, and that's why we get bigger and bigger. We get more obese because we're not flushing and detoxing properly.
Bloated.
That's right. That's one of the issues. Bloating, sneezing, coughing, etc. are all signs of being too toxic. So the Ondamed helps us to identify where on the body are the problem areas, and that might be even a memory of an unresolved shock or trauma emotionally. It's really a comprehensive approach of picking the individual up in a personalized and precise way to where treatment needs to happen and with what it needs to happen.
Okay, in the course of my research on this, I came across where it is said about its fastness. How really fast is it? I know, considering the stages now. Talking about the Ondamed technology.
Yes. So
I was made to understand that it has a lot of advantages over some other existing technologies. And it's the fact that it's fast is one thing I picked from. How fast can it be?
Well, usually in the first session already, if I spend 5 minutes with you, give you the scan, I can tell you the indications that are showing up, not because of my knowledge or experience, but because I'm listening, meaning I'm palpating your radial pulse as I'm stimulating you, confronting you with the gentle pulse electromagnetic fields. I'm waiting for feedback from the autonomic nervous system. So it's almost like a lie detector. I'm like I would investigate you and ask questions and see if you're lying or not. And the information comes back from the autonomic nervous system that controls all of our involuntary actions. What does that mean? So when you're breathing, you're not thinking about breathing, it just happens automatically. That's the autonomic nervous system. Or when we're blinking, that's the autonomic nervous system. Swallowing, So we're actually overriding. Like psychiatrists, psychologists, they use the words to understand what's going on, which is wonderful, but it's limited because the patient doesn't know what's going on with them often. So we're overriding. So it takes me a few minutes to understand where are your problems and what are the indications, and then I go right into treatment. And it takes about 45 minutes to an hour to do the treatment.
I know that countries, in the absence of vaccine, are still looking for ways of mitigating the impact of the global pandemic. What gap can the Ondamed technology close at this point in time? And it's a German technology. I'm interested in knowing how Nigeria is keen into. Is this something that Nigerians can take advantage of? Is it available?
Of course, it's available. Okay. Germany is not far from Nigeria.
It's not far from Nigeria, but there's a lockdown.
It's a lockdown, correct. So we cannot travel anywhere really in the whole world. So now, but still machines are coming into the country. So we have a 6-hour flight, right? Even for machines, they're flying in here still. Transportation is not a problem. So devices are being flown in here. We actually have one device coming to Abuja tomorrow. It's coming into the country, and then from Lagos to Abuja be used in an integrative medical center right here in Abuja. And the one is already being used in Lagos by private people. And then very good news, in January, the federal medical director of the federal hospital which is a government hospital in Bida, Dr. Ushman, he actually purchased a device, and he's off his shoes, he said, off his feet, with the results, not only helping people with their chronic diseases and acute injuries, but also helping to prevent. So that's where Ondamed can fill the gap, while we don't have any other solutions in improving immune, not just fighting and killing a virus. The trick should really be in strengthening our immune system so that we're all able to fight off whatever it is that comes in, right? Whether that's malaria, whether that is typhus, whatever it is, to strengthen immune functions. And also that applies for COVID-19. Around the world, Ondamed is being used. It's been used on millions of people by thousands of practitioners. And during COVID-19, I developed a COVID-19 protocol of how to use with patients that are in the intensive care unit, as well as also for integrative medical practices, where patients go to stay well and be well, is to use preventative protocols. So there certainly is a wonderful opportunity to use a device with a one-time investment. I'm not here to sell anything, but it's a one-time investment, you know. You don't have to store anything. You don't have to keep on ordering and shipping, and it's so much easier and sustainable. Isn't that what we're looking for?
But how affordable is it?
How affordable. It's well, when you calculate that you will have this device for 20 years, well, then it becomes very affordable when you spread it over thousands of patients used.
So I will it be right for me to say Ondamed could be used in almost all disease conditions?
Yes, because we don't treat disease, you see. The Ondamed doesn't treat disease, but the reasons of why disease manifests in the body in the first place. So you may have had a childhood trauma, and here you are 40 years later, you don't know what happened, but an accumulation of you getting weaker, not sleeping well, having no energy, you're having pains that come and go, you don't know what's going on, you've had 10 different physicians that talk to you, blood tests were being looked at, but nobody has a clue of what's going on.
Yeah, well, in this part of the world, it's easy to say one is having a spiritual attack. I don't know if you're familiar with
I am very, I watch epic movies.
So Ondamed could actually reveal or puts all of that to rest.
It can, because it will show the patient of when things went apart from being in your center, in your strength, in your power. When did the spiritual attack happen? Which may be a spiritual attack, but it may just be your own spiritual attack against yourself. You know, God lives within us. So this is when there is let's say we separate from the powerful self we're here to live. This is when really we separate from being the most healthy and well-being that we can be. So the journey starts much earlier to when we then 40 years later are considered to have fibromyalgia, or we have third stage mama carcinoma, breast cancer. Well, why? Well, we can link, because the integrative approach of naturopathic medicine, you know, I don't just lean on Ondamed, although it's my main tool, but I'm looking at the emotions. If it's a right side breast cancer, I would, the German new medicine, Dr. Hamer's work, would link that to unresolved issues with your either husband, spouse, or father. So I present this information, I scan, I find, I present the information while the Ondamed is already doing the treatment electromagnetically, pulling blood into the area which is needed for repair, pulling electrons into the area which gives energy in order to do the repair, and pulling the immune cells into the areas of where it's most needed. Even if your CRP levels are elevated, which is the inflammation markers.
On a final note now, I know you know what the treatment protocol for COVID-19 is. If one who has been diagnosed or has tested positive for coronavirus, and he has the options of going for maybe the conventional treatment protocol and Ondamed, what edge has Ondamed over the conventional treatment protocol?
Well, the conventional treatment has side effects. The Ondamed, of course, coupled with, I would put the Artemisia annua, which is a plant grown right here in Nigeria. That is what I would use. Vitamin C, vitamin D injections, and the Ondamed. That's a beautiful solution, and you will see patients will be well within 3 to 4 days, much faster than the hydrochlorics and the hydrochloroquine. Yes.
Thank you so much, Dr. Silvia Binder, for
You're
coming.
You're very welcome.
We have different modalities of managing, diseases, and the Ondamed is our latest that is going to come on board here. And as it has already been explained, you can see the tremendous benefits where you can use a non-invasive technology to address and manage, disease. We believe that in combination with what we already have here, we will really go very far in meeting the needs and in terms of healthcare of our population in Nigeria.
A disinfection tunnel is a means of spraying the public as it travels through a cubicle or tunnel with a chemical mist of variable composition aimed at disinfecting all exposed areas, including hands. Disinfection tunnels have also become popular in some climes as a result of the global coronavirus pandemic. Check out one of such.
So when you come in, it tells you to wear your mask, and it tells you your temperature. Then you put on your mask like this. You sanitize your hand first. This is a hand sanitizer. And when you sanitize your hand, after it has taken your temperature, it will store your picture into the system. This is a big demonstration for when the temperature is above normal. When you walk in and it declares, this is what happens when the temperature is abnormal. So now we go into the main chamber, which is the full body disinfecting chamber inside.
The chemical in itself, if you use it in the raw form, it has a pH of about 6 to 8. So, and anything below 7 is acidic, but as from 7 and above, or anything above 7 is basic. So, but by the time you do the right dilution, you carry out the right dilution formula, the pH turns to 11, which is way, way basic.
That does it on this episode of Health Options. COVID-19 is real, so take responsibility by observing all the safety guidelines and avoid touching your face with your fingers, as the nose, mouth and the eyes are easy channels through which the coronavirus can get into your system. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdallah. Stay safe. Hope to see you again.